Good morning, everyone, and welcome to episode 267 of the On Air Advocate. Where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are here this morning joining us, or whether you are catching this on the replay. Now, as always, if you think any of the content that we could be talking about this morning could be relevant for anyone in your network or your circle, please hit the share button and share the love with others. Well, if you guys have been following us all week long, you know that we are in our Spotlight Week over here at the On Air Advocate, and we are so excited today to be spotlighting Parkinson's Awareness Month, and even more excited to be welcoming Dr. Gilbert, Chief Scientific Officer for the American Parkinson's Disease Association. Welcome, Rebecca.
Thank you so much for having me. It's a pleasure to be here.
Yes, you have not been here to the platform before, and actually this is our first episode out of 267 episodes that we have spotlighted learning more about Parkinson's disease. So I am so excited for you to embrace our community and share that today. But before we get rolling on diving into Parkinson's, can you just let us know a little bit about you?
Sure. So my name is Rebecca Gilbert, and I wear two hats. I'm a movement disorders physician, which means I'm a neurologist with extra training in Parkinson's disease and related disorders. And I see patients in that capacity. And in addition, I am the Chief Scientific Officer at American Parkinson Disease Association, which is a national organization that supports people and their care partners with Parkinson's disease. And in that capacity, I work to share information and education about Parkinson's disease with our community, and I organize our research component of our organization.
Wonderful. And Dr. Gilbert, how did you get involved in that, if I can ask? I mean, was there a backstory of how you kind of got passionate about the organization and wanted to get involved?
Yeah, so that's a great question. So I did not ever think I would join an organization like APDA, and I was working as a movement disorders physician for many years. And part of me wanted to sort of have a bigger impact and be able to design programs and organize research on a more global and national level than I was able to do on a day-to-day basis with individual patients. So now I have the best of both worlds. I'm able to see patients and also have my hand in a larger picture of the disease.
I love that. Well, and I'm sure that you have been such an asset, to them and being involved and really able to share that out on a more global platform. As we kind of dive into why we are here today, which is Parkinson's Disease Awareness Month, I really want to get into what is Parkinson's disease to kind of start with, because a lot of us, when we hear the word Parkinson's, you know what I think of, and maybe it's my generation that I was brought up in, but I think of Michael J. Fox.
Yep.
You know what I'm saying? Like, as a spokesperson, not really knowing much about the disease itself, but just knowing that when someone says it, it's like you recognize, oh, that person that you knew within the media has this.
Absolutely.
And, I would love for you to kind of kick it off here for us.
Yeah, absolutely. So of course, it's wonderful to have spokespeople for different diseases. And I'm sure in your work, you find that that's a big asset to be able to introduce people to a condition. And so my hat's off to Michael J. Fox for really being a public face for this disorder. For the general population, however, they may notice some differences between their condition and Michael J. Fox. So it's important to point those out as well. So Parkinson's disease more generally is what we call a neurodegenerative disorder, which means it's a disorder in which the nerve cells in the brain begin to die. And we don't quite know why that happens. And that's, of course, really at the basis of what research is trying to figure out. And what happens when these nerve cells die is a specific set of symptoms that can take place in an individual. And we group these symptoms into two big categories. We have the movement symptoms, and that's why it's called a movement disorder, because certain things happen to a person's movement. And we also have a whole other set of symptoms called the non-movement symptoms. And in the movement symptoms, you may be very familiar with a tremor. A tremor can happen in Parkinson's disease, but not for everyone. So about a quarter of people with Parkinson's never develop a tremor, and that's something people may not be aware of. In addition to the tremor, there's a slowness of movement, a stiffness of movement, and typically problems with walking and balance. But on the other hand, Parkinson's disease can also encompass other symptoms such as sleep disorders, mood disorders, cognitive disorders, problems with bowel and bladder, problems with blood pressure. So it can be a rather comprehensive condition. Having said that, Parkinson's disease is very varied. So not everyone gets everything I just mentioned. And it is sort of very individualized about which symptoms a particular person might get.
And with it having that many varied symptoms about it, is it hard to diagnose, or sometimes is it misdiagnosed, I should say?
Well, both those things. Certainly, there are patterns, there are clinical patterns that can be recognized by people with neurologic training. And so certainly if someone out there is concerned that they have Parkinson's disease, they shouldn't be worried that no one will be able to recognize it. There are some characteristic things to look for. But having said that, there is a bit of variability in that as well. So you do need to have a fair amount of expertise to tease out some of the specific symptoms that may be able to be recognized on exam. And so if someone out there is concerned about some symptoms, certainly make an appointment with a neurologist and get some clarity about what's going on.
And, here's so much at the On Air Advocate, we talk about knowing our family's medical history and how important that is. Does this have any genetic component to it of, family history?
Yeah, certainly. It's a great question. So it is a complex disorder. It's a very varied disorder, as we talked about. And much like all chronic diseases, so I would include in that diabetes, heart disease, etc., the risk factors for developing the disease are a combination of genes and environment. And exactly which genes and exactly what in the environment is under investigation. We do know some things, but we don't know everything. And so certainly there are many genes that can influence a person's risk of getting Parkinson's disease. Some of these gene mutations affect the risk a lot. And if you have it, you will most likely get Parkinson's or have a very high risk of getting Parkinson's. And some of these gene mutations are very slightly increase the risk. And so there's a bit of variability there. In general, most people with Parkinson's do not have a first-degree family member with the disease. They may have an accumulation of genetic risk factors over time and that particular combination of genetic risk factors pushes them to get Parkinson's disease, but they're not necessarily seeing it specifically in other family members. However, about 10 to 15% of people do have a family history. And that family history may be a lot of family members. And so, there's a very high level of understanding of Parkinson's disease in the family. It may be one family member. So there's a lot of variability there. So having said that, if somebody does have a family member with Parkinson's, they are at an increased risk, a small increased risk. So for all comers, the general population, it's about 1% chance of getting Parkinson's. If you have a first-degree relative, that goes up to about 4%. So there is an increase, but it's not a massive increase.
Okay. And if you have that in your kind of genetic line, so even if it's skipping, generation, it's a grandparent instead of a parent and whatnot, if you're starting to see symptoms, do you guys do genetic testing to make sure that you have, what are those mutations?
Right. That's a great question. And that is really such an on-point question that people are grappling with right now. The question of what to test for, because there are a lot of different genes that can affect the risk. And we know more or less about those different genetic mutations. And so different commercial labs are going to be testing for different things. So there really isn't one gene pool or gene selection of tests that is consistent across all labs. So there's a lot of work to really hash all this out. And it's also work in progress. As new genes are being discovered or variations of genes being discovered, those tests vary and change. And so the answer right now is if somebody has a family history and goes to a neurologist and they find signs of Parkinson's disease, there isn't a knee-jerk reaction to get genetic testing. That, however, is changing. And the reason it's changing is because certain clinical trials are becoming available, which are including specific people with specific gene mutations. And so we need to know much more acutely who has these gene mutations. And so every day, the answer to your question is changing.
Okay. And what about early prevention? You know what I'm saying? In so many different conditions, we talk about, early detection means early prevention and how we can do this. Is that the same here? Because I don't know. I believe you'll touch on it, but the age range, does this have an age range?
Yeah, so it really is a disease of aging primarily. And so the rates of Parkinson's disease clearly increase with age. Having said that, about 10% of people will develop the disease rather early and could be before the age of 40. And so early onset, there are two definitions, one before the age of 40, one before the age of 50, depending on where you stand. But certainly there is a group of people with Parkinson's who develop Parkinson's early and not really as a disease of aging. But we do want to state that most people develop it as they age, and the average age of developing is in the 60s and not really earlier than that.
Okay. And so that early detection, if it can be detected early, okay, and not go on, is there any type of early preventative medicine or things like that can help?
Right. So again, this is a hot topic, and there have been numerous trials trying to find what we call the neuroprotective agent, the one that if you're at risk, maybe you have specific genes, maybe you've been exposed to specific elements in the environment, and altogether you are considered somebody at high risk. What can you do about it? We've had many trials trying to find a neuroprotective agent, and they all have failed to this point. There are many questions about why that's the case. Perhaps it's because we don't give those neuroprotective agents early enough. We're not giving to the people who haven't developed symptoms yet. We're giving to people who have symptoms already. And so maybe that's the problem, that we're not catching people early enough for these medications. Regardless, we have not found a neuroprotective agent yet. However, there is evidence that exercise is a very, very important element and potentially even neuroprotective. And so somebody who may have a genetic profile that makes them more at risk for Parkinson's, exercise may be a good way to make sure your brain is as protected as possible should Parkinson's disease develop.
And we know that exercise and movement is, so important for everything. If we're not moving, we're not, getting our blood circulating and really protecting ourselves from everything. So the next thing is, if somebody would get diagnosed, so let's say I'm newly diagnosed, and for so many conditions we do that, like we find out about something, and then we're like, okay, so now what? What am I supposed to do? What are those next steps?
Yeah.
When I was diagnosed?
It can be an extremely overwhelming thing to hear that you have Parkinson's disease. And we hear this so many times from so many of our constituents about that period of time where they're told they have Parkinson's and they felt completely lost and overwhelmed. And so just to mention my organization, American Parkinson Disease Association, we have a tremendous amount of information that really lays out the basics of the disease. We have a great short 15-minute introduction to what Parkinson's disease is, and gives you some information about what to do with this newfound challenge that has been presented to you. And so finding reliable sources of information is really paramount. And as you know, in your work, there's a lot of misinformation out there. And so really finding good sources, I think, is the first thing to do. And then finding a support network. There are support groups that our organization can connect people to. There are other organizations out there that can do the same, and finding other people in your position to face this with. The American Parkinson Disease Association has a specific support group for people that are diagnosed within the last 5 years to work through some of these issues that may come up early on in diagnosis, and that's called our PRESS program. And that, again, would be something that may be helpful to people early on as they're grappling with this condition.
Okay, and now, and I do want to get a little bit deeper into the foundation, the association, the resources, and all of that stuff. In just a little bit, I have just a couple more questions,
Absolutely.
especially during these pandemic times and COVID-19. You know, there is that question across the board for different conditions and whatnot. Like, is the vaccine, you know, suitable for those that
Mm.
have Parkinson's? Are people that have Parkinson's more susceptible to
Oh, yeah.
COVID? So, I mean, I know for each condition, you know, even the Asthma and Allergy Association, you know, all these questions. Okay, so if my child has allergies, are they really a candidate for this? That question, just for all different conditions, has been going across the board. So, I would love your input on that.
Oh, absolutely. We have gotten so many inquiries about this, as you've just mentioned, and we've dedicated some pages on our website to dealing with COVID and the COVID vaccine, and those are absolutely the hottest pages on our website. People really, really are craving this information. So, in terms of Parkinson's disease and COVID, in the beginning, we really didn't know what the relationship would be between the two conditions. And now there have been a number of case series where physicians across the world have looked at their Parkinson population who've gotten COVID and have analyzed what the story is. And it turns out that people with moderate to mild moderate symptoms have pretty much the same risks as other people their age. It doesn't seem to affect the risk terribly much. In the more advanced stages, however, there is definitely a relationship between having Parkinson's disease and a more complicated course. So it does not seem that Parkinson's increases the risk of getting infected, but there are certain elements of having advanced Parkinson's that makes the course more complicated. That would be sometimes the swallowing function is diminished, the cough function is diminished. That can make the respiratory issues of COVID more severe. There can be cognitive problems with Parkinson's, and those can get complicated when somebody is acutely ill. And so we do find that keeping COVID away from the more advanced Parkinson's is really, really crucial.
Yeah.
In terms of the vaccine, we are very encouraging of people getting the vaccine for Parkinson's, just because of what I mentioned. Of course, people with advanced symptoms, we want to protect them much more acutely. And people with moderate symptoms that may be approaching more advanced stages, of course, as well. And even people with milder symptoms. As I mentioned, Parkinson's is a disease mostly of the aging population. And so we all know that just age alone increases your risk of complications from COVID. And so we really do want everybody that we touch to be protected with the vaccine.
And speaking on COVID, and earlier when you had mentioned how important exercise and all that is, I know in different areas, some things are open, some gyms are open, some, are not yet. And then you have to think, if you are pretty compromised, I know for my son who has chronic illness, his physician doesn't want him in a gym. And so with that being said, and exercise being so important, what would you say are great ways to still get that exercise in if you can't go to the gym?
Absolutely. And so our entire organization pivoted to a virtual platform, and we have multiple online exercise courses that people can follow. And we definitely encourage that. And we've seen a massive uptick in people accessing our online exercise courses. So that is a great way to stay active. And then, of course, going outside, walking, with a care partner or a friend is also a great way getting that fresh air, especially now that it's getting nicer. And so there are definitely ways to stay active in the pandemic. What I should mention is that I just discussed COVID and the COVID vaccine, but another whole element of this is the actual lockdown's effect on people with Parkinson's. So Parkinson's is already a very isolating condition in terms of decreased ability to move, as you mentioned, especially in this time, staying away from groups. And so the lockdown itself had huge health implications to our community in terms of decreased amount of exercise, increased isolation, increased depression. And I saw this in patients of mine who were doing well before the lockdown and really took a hit emotionally during the lockdown. And this has been captured in the medical literature as well. So I really think there's a fallout, unfortunately, a necessary fallout. It wasn't anything we could prevent entirely, but it's definitely something that will have reverberations for years to come, as far as I can tell.
Yes, and I can say that across the whole caregiver chronic illness community is that I think that in one way we are already used to some of that isolation, right? Because we've already been dealing with it, that others haven't. But then in that isolation, you only have that small fragment of things you actually get to do. And now those being taken away, yeah.
Exactly.
I feel like,
Exactly.
and that's where I encourage so much. I know that we as a family have been doing telehealth for mental health this whole the whole pandemic, and that has really helped. So I highly encourage that. For
Yes. Absolutely. Same thing in the Parkinson's community where telehealth has taken off, and mental health specifically mental health sort of lends itself more easily to telehealth. There isn't a physical exam. You don't have to listen to a heart.
right.
And a lot of it can happen pretty seamlessly on telehealth. So that's a really great thing to pursue. Agreed.
And kind of as we wrap up, I would love to know kind of all, I guess, say the different divisions that the American Parkinson's Disease Association has to offer. I know earlier in the segment you had mentioned a little bit about like support groups and things like that. Is that for caregivers? Is it for families? Is it just for the patients? Do you
Yeah.
guys have activities, events, webinars, things people can get involved in?
All of the above. So we're a national organization. We have chapters located across the country, as well as information and referral centers located across the country. And it used to be that those local organizations conducted local programming. And in the pandemic, everyone moved their events online. And so all the programming offered locally is now really offered to everyone. And we have a wonderful virtual calendar. So if you go to our website, apdaparkinson.org, in the top right corner, you can click on virtual calendar, and all the events are there. And they include exercise classes, support groups. They include educational programs of all types. There are, full day programs, half day programs, one-off webinars that take 1 hour, etc. So all that information is there, and you can register for anything, and everything is free. I mentioned exercise classes as well. There's cognitive rehab classes, there's dance, there's Tai Chi, yoga, really anything you can imagine is there. So go ahead and take a look and see all the different programming that we have to offer. And I'm sure there's something for you there.
And with your association and funding, I know so much of the time when people are making donations, getting involved, volunteering, doing all of that, it's striving towards more research. Where are things at with you guys research-wise, and what is your hope as we leave 2021 and 2022, and what are you guys looking in the forecast?
Right. So I should absolutely mention our research program as well. So I already talked about our programming side, but we also have a grants program where we fund researchers across the country who are working on research that will hopefully advance the field of Parkinson's disease. Our niche, our research niche, is to fund early projects and new researchers in the field of Parkinson's disease. So the idea is that people who are already established, they may have the data, they may be able to write a large grant to get funding from the NIH, let's say, but as someone who's starting out, getting that first data, getting that first grant is often extraordinarily difficult because you don't have a track record. And so where we come in is we love to offer that first bit of funding for the most promising projects, which then can be turned into preliminary data for a larger grant. And we find that this MO, this way of operating is highly successful. And we go back to people years later and they're like, thank you so much. You gave me my first grant. And now I was able to do X, Y, Z. And we find that's an extraordinarily impactful way of really impacting and informing the Parkinson's research world. And so our projects that we're funding now range from studying the microbiome, which is all those trillions of bacteria that live in the gut and how that affects Parkinson's disease. We have a project that we're funding on that. We have a project on telehealth and mental health that we're funding. For example, we've funded a project on deep brain stimulation, which is a surgical technique for Parkinson's, and doing that technique very earlier than typically done, et cetera. So we have a lot of really innovative and interesting ideas that we find that if we get in on the ground floor, we can really make an impact.
Wonderful. You guys are doing some amazing work. And I thank you, Dr. Gilbert, so much for being here this morning with us and sharing with us. Here at the On Air Advocate, we will be spotlighting Parkinson's Disease Awareness Month all month long. So there will be other literature and all of that out. Dr. Gilbert, where can people find the information? So the website?
The website's a great place to start, apdaparkinson.org, and we will provide all the different links on that website for the virtual calendar, for some of the other projects that I talked about, our research, et cetera. So I think if they look below this webcast, all those links will be there soon.
Oh, wonderful. Well, thank you again for spending this Friday morning with us here at the On Air Advocate, Dr. Gilbert.
Thank you so much for having me. Any other questions? I'm happy to answer. If you get any, you can send them my way. No problem.
Wonderful. Thank you so much. And thank you all for watching the On Air Advocate this morning. If you guys want to know any more about the On Air Advocate, you can head on over to onairadvocate.com and you can find all of our resources and services right there. With that, you guys have a wonderful weekend. Thanks so much. Bye-bye.
Bye.